number of countries and the technologies that are currently on the CTAP platform. So what I propose we do is we get that information, we send it through Margaret to you, and maybe bring, on Monday we will also maybe give a couple of minutes to give an update on CTAP, if that's okay with you.
Excellent question, and just send it to me, harrism@who.int, and we'll make sure you get a good answer. The next question is for Isabel. We're going to try. Isabel has reconnected. Isabel from FS. So Isabel, please unmute yourself and ask your question.
Yes. Do you hear me?
Very well. Please ask your question.
Thank you. Thank you. Thank you very much for trying again. Thank you. My question is, as you know, there are several outbreaks in Spain, and most of them, even if they are restricted to a few geographical zones, this is happening after you warned that we should have been very careful after the confinement. And I would like to hear from you, what is the lesson we have to learn in Spain and in other countries? In this context, a quite important proportion of these contaminations happen in nightclubs, as you mentioned. Do you think that it's most reasonable to close these sites until the situation is under control?
I think I think we have to be careful here that when we see clusters of cases or a rise in cases after lockdowns are lifted, that in some way that is projected as an error or a fault or a failing. It happens. The minute you raise the pressure on the virus and the virus is at community level, you will see sporadic or clusters of cases. The question you should ask is, what is the reaction to that? What we've seen is in areas that have lifted restrictions very early without having control on the virus have seen a very fast jump back up. But in other countries, even in countries that have brought the disease under extreme control, like Germany and Spain and others, where the numbers have been suppressed to very low levels, that when you open up, there's always a chance that the disease can be imported or the disease can spread from unseen clusters. And the real, I suppose, test of community and government is how quickly can you get those under control? How quickly can you detect the cluster? How quickly can you test the people in that cluster? How quickly can you get the results from that? How quickly can you identify the contacts? How quickly can you identify the risk factors? Was the risk factor a nightclub? Was the risk factor a mass gathering? What do you need to do at the community level to prevent that happening again? Do you need to implement some local movement restrictions? What we're really trying to get here is move from, as I've said before, using a very big hammer to trying to be more precise in what we're doing. Instead of restricting everyone, we try and go after the virus and we try and identify where the virus is and then specifically and surgically, in a sense, excise the virus from the community by minimizing the impact on the lives and livelihoods of the community by focusing in on cases, on contacts and investigation. So countries coming out of lockdown, even countries with low levels of disease, will experience potential cases and clusters of disease. And I believe in this case, Spain, like many other countries, have reacted quickly, they've reacted well, and are on the incidence of disease is stable, and yet we still have to deal with a few of these clusters that have emerged in a number of countries. So I think, and that is really how we get to what the DG spoke about. We have to learn to live with this virus. We will not be able to eliminate or eradicate this virus in the foreseeable future. And we have to learn to find a way to get back to our lives, to get back to some kind of normality, to do that with, as Dave has spoken about, with respect to human rights, with respect to the use of law, with using every single tool that we have as a society to suppress this virus in a sustainable way, to make maximum disruption to the virus and minimum disruption to ourselves. Now, how do we go about doing that? And we need everybody on board. The DG spoken, it's not just the authorities on board, it's not just the responsibility of the authorities, it's also of communities and people within those communities. And more the youth, and not just the older ones, the old fogies like myself and others. Youth culture can break this. Youth culture can help drive this pandemic, or youth activism can help break the back on this virus. And going to the issue then of closing sites, everything about gathering is related to the background incidence of the disease in the community. If there is no disease in the community, then it's safe to re-engage in normal activities. If disease is in the community and if you have intense community transmission, then any activity that brings people together in crowds, especially indoors, will lead to further transmission of the disease. Because if you don't know where the virus is, but you do know the virus is spread in your community, and you bring people together in large groups, you're going to get transmission. And in that sense, governments are going to have to make decisions based on the local epidemiology as to whether things like bars and clubs, in particular circumstances, need to be closed or have restricted numbers, or whatever it is they need to do to reduce the chance of person-to-person transmission. Maria?
Thanks. I really appreciate the question, because I think so many people are dealing specifically with this question. Of what are the lessons that can be learned, once you've been successful at suppressing transmission, what about these sporadic cases and clusters that are starting to appear? I think the lesson is that we should expect this. We should be ready for this to happen. And with all of the systems that are in place now, which countries have worked so hard to put in place, they need to be used fast. They need to be used aggressively and robustly and with no regrets, with the exception of ensuring that when these interventions are put back in place again, where you may shut down something temporarily, it's done for a temporary amount of time, and it's done in the lowest or smallest geographic region as possible. I think everyone wants to avoid these huge so-called lockdown measures again. We do too. We hope that we don't need to see these again. But if these outbreaks are dealt with swiftly, if the test, treat, contact trace, care for, if all of that is put in place and done really quickly, you have an opportunity to really put that fire out quickly. And we are seeing countries do that. I think it's important to know where, as Mike has said, where these outbreaks are occurring. Is it in a particular entertainment sector? Is it in a long-term living facility? Is it in another closed settings? And if you, as an individual, have an opportunity to avoid going to a nightclub, maybe it's worth avoiding that nightclub for a little while. I don't think we've talked so much about nightclubs in recent days and recent weeks, because these tend to be the hot spots right now. But I think having a blanket of closing all nightclubs is not the solution either. I think we need to have a data-driven approach. Where is the virus? Where are the opportunities for the virus to transmit? If it happens to be in a certain area, then yes, perhaps maybe they need to be closed for a little while. But again, you have a choice yourself to make and say, do I do this? Do I go to this? I said the other day, there's a lot of things that people want to be doing. I do too. We all do here. But there's not necessarily things we need to do. The things we need to do to keep our families safe and alive, and we need to perhaps make some sacrifices ourselves, so that essential workers and frontline workers who are putting themselves at risk every day to keep businesses going, to serve us food, for healthcare workers who are out there who are caring for patients, they need to go to work, and they choose to go to work proudly. And we are very grateful for that. So again, we all have a role to play, and we really do need to make decisions based on risk to keep ourselves safe and keep our families safe.
Thank you very much, Dr. Van Kerk.